So in this segment, we're going to be talking about a few different things. We're going to be talking about the rise of the coronavirus. In England, we're going to be talking about different lockdowns in Birmingham and also Lancashire. I think it's Lancashire. Let's double check that. Yes, it is Lancashire. No, it's Lanarkshire. Whoops. In Lanarkshire. So let's have a look at this article first. So coronavirus UK epidemic growing as R rate goes above 1. And so the government's latest R rate number is between 1 and 1.2, which means the epidemic is growing. And so the R rate is the rate of infection. So say one person would infect another person, that's an R rate of 1. So if one person infects 2 people, that's an R rate of 2, I believe. That's generally how it works. And so just carrying on in the article, the audio might be a bit tinny because I'm using a different setup, which I apologise about, but needs must. So let's see. And a study of thousands of people in England found cases doubling every 7 to 8 days, with a marked rise in the north and among young people. New laws on how many people can socialise indoors and outdoors are being introduced from Monday. The rule of 6 will ban gatherings of more than 6 people indoors in England, Scotland, Wales and Northern Ireland. The number of new daily confirmed UK cases of the virus has risen to 3,539 on Friday, an increase of more than 600 on yesterday. And there's a separate one I'll have to do. France, I think they're seeing about 10,000 cases a day or something like that. It's crazy. I'll double check that number in post, but yeah, Yvonne Doyle, medical director at Public Health England, said there were now worrying signs of infections occurring in the elderly, and she warned people to follow social distancing rules, wash their hands regularly, and wear a face covering in enclosed spaces. So standard stuff. There, it's been announced that Birmingham will become the latest area to bring in new restrictions after a spike in cases, and this is affecting about 1.6 million people. That's what we'll get to when we talk about Birmingham specifically. But here we've got some analysis from James Gallagher, a wake-up call for the nation. The UK is entering a new stage of coronavirus pandemic. Since lockdown, we have been deciding how to react to falling cases, but now the R number has gone above the crucial level of 1 for the first time since March, and is backed up by reams of data showing cases are growing again. This is not just contained in hotspots like Bolton, one government advisor told me. The rise was widespread across the country, so a local lockdown may not be enough. 1 or 2 local lockdowns may not be enough. They said today was a wake-up call for the nation. There have been some signs that the number of people being admitted to hospital is starting to rise. That's where it gets scary. When people start dying and going to hospitals and needing ICU units, that's when things get real. But this is not a repeat of the build-up to lockdown. Cases are much lower level, and they are growing more slowly. Pre-lockdown, the R number was around 3, and cases were doubling every 3 to 4 days. Now it's about half that. Coronavirus is a major challenge until we have a vaccine. So the defining question as we head into potentially difficult winter is how to balance the virus in check with getting on with our lives. And that's going to be the difficulty, is where do you draw the line? And these are some numbers. It's quite confusing the way they've done this. So the range of COVID in Northern Wales is either like 0.4 or 1.4. So the numbers are way too vast to have any kind of decent indication on some of these. But you can see Scotland's a risk. Scotland's at above 1. England in general is between 1 and 1.2. East of England between 0.9 and 1.2. And yeah, the Midlands is the one. Obviously I live in the Midlands, so that's between 0.9 and 1.1. So either one person infecting another person, or just over one person on average. The REACT study of more than 150,000 volunteers in England, one of the 3 new sources of data on community levels, found accelerating transmission at the end of August and start of September. I wonder if that has anything to do with the Eat Out to Help Out thing. But that was mainly during August, to be fair, and ended in August. There were increases in positive cases in all age groups up to the age of 65, with the highest rate of growth in 18 to 24. That's not the most surprising thing, because a lot of younger people do work in service sector and things like that. And obviously you're more likely to be on a bus or in public transport if you're younger, because you don't have a car. So that makes a lot of sense in a lot of ways. Obviously younger people take more risks because the virus is less likely to affect them. Some people out there think they're He-Man. So if you look here, it's quite high amongst younger people. Also, I'd love to see the actual age range of people that are generally tested. Maybe it is younger people that are tested more as well. And so there's not much more important stuff here. So if we look at the FT numbers, as they do great work, you can see, we're at about 37.9 cases per million right now. And look at the UK's peak is at 72.3. So about, what's that? About half of the height it was during the first lockdown, and you know, it's not looking like it's slowing down anytime soon. So if we go into the next article, scroll back up. Coronavirus Birmingham lockdown restrictions increased. So households in Birmingham have been banned from mixing in new lockdown measures following a spike in coronavirus cases. The city has the second highest rate of COVID-19 infections in England behind Bolton. The measure will cover neighbouring Sandwell and Solihull, affecting more than 1.6 million people. The restrictions will begin on Tuesday. So you can see Birmingham might be one of the reasons why the Midlands are so high, but also Northampton is quite high as well. So Mr. Ward told the meeting there is where it becomes a little odd. You can continue to go to restaurants and pubs in a maximum group of 6, so that would allow you to meet another household. But the thing is, you're not technically meant to meet another household, but you can meet another household because no one's going to know. So it's really just a moral thing that they're asking people to do. So basically, you can meet other people if there's not a cash point, a card machine nearby. That's basically how it's going at the moment. So West Midlands mayor. So West Midlands have a mayor. Damn. The areas will now be escalated to an area of national intervention with a ban on people socialising with people outside of their household. They'll probably get a mobile test centre as well. More mobile test centres if they haven't done so. So you've got Edgbaston, that's a weird one, 21 cases. Greet and Spark Hill South, 31 cases. Springfield and Hull, Green West at 39 cases. You got some other like grey areas who aren't doing too great by the looks of things, I think, as well. So you've got some analysis here. Birmingham has the highest coronavirus infection rate in England, standing at 85.4 cases per 100,000 as of the week to the 7th of September. The week before that, it was 32 per 100,000. So it's doubled in the space of a week, which is terrifying. According to government's more local data, Birmingham is home to 6 of the 10 neighbourhoods with the highest number of positive cases in England. So you can see here Birmingham is not doing too good at the moment. Mr. Ward said the virus has not weakened, calling it relentless. I mean, we've already known this, and there's a separate video I'll be doing about how much Trump knew in February. That's in an interview he did with Bob Woodward, which is really interesting. And you got a question: if Trump was told so much in February, how much did Johnson know before the lockdown? How much did he know in February and March? That's going to be one of the talking points of the video, I suppose. This is talking about specific people, so let's not bother with that. So now we go to Lanarkshire, not Lancashire, Lanarkshire. That is a mistake that I made. So tougher restrictions on home visits have been extended in Lanarkshire. People living in the area will not be able to meet other households indoors midnight on Friday. Similar measures are already in place in Glasgow, East and West Dunbartonshire, and Renfrewshire, I think that's how you pronounce that, and East Renfrewshire. So you can see in Scotland it's not looking too good either. They've got further lockdown measures in Lanarkshire. In Birmingham there are further lockdown measures. And also nationally we can see that the coronavirus is spiking. So it's not just these specific areas, it's all over the country that these rates are typically going up. And if we look at the FT numbers one more time, you can see it's not looking too good for the country, and we are on an upward trend, not a downward trend. So that means that cases will keep going up, and it's not flattening. You know, when they kept talking about flattening the curve means it'll go like this. That's flattening the curve, or like that. It's not flattening, it's going up. It's going up very rapidly. You know, we had on the 23rd of August, it's 15.6 per million, and now in the space of a few weeks we've got 37.9, and so that's scary stuff. So anyways, I'll leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.